Thank you. Wonderful. So again, we are with the online Masters in Public Health program at UC Berkeley. So we're housed within the School of Public Health. And my name is Elise Rudolph. I use she, her pronouns. I'm the Director of Recruitment and Admissions here with our online MPH program. And I'm joined by my wonderful colleague, Stephanie Nguyen. Would you like to introduce yourself?
Sure. I'm Stephanie Nguyen and pronouns she, her. My role is the online education recruitment manager. I work in tandem with Elise, a part of the admissions team. So, we support students with providing you information about the program, guiding you throughout the application process. So if you have any questions, be sure to ask us at the end or book an appointment with me, which I'll include at the very tail end of the presentation. I wanted to continue on with introductions. So Peter Lay and Samantha Dong are unable to be with us today, but I really wanted to highlight their work and the incredible services and resources that they support. So Peter Lay holds positions as the director for both the TRIO Student Support Services and the director of the George A. Miller Scholars Program. And Samantha Dong holds both positions within EOP space as the assistant director as well as the SSS STEM director role. So the center, but it's essentially a resource hub for support with holistic admissions guidance, scholarships, mentoring, and career preparation to nutrition and childcare support for undergraduate students. So make sure to take advantage, full advantage of all the resources that are available to you there. And I'm so happy that they have been open to partnering with us for this special information session. And we hope that this helps you learn more about graduate school and just the different public health pathways. So I'm also incredibly excited to continue introductions with one of our most standout alum in our program. So here we have Dr. John Rodrigo, who holds an MD and an MPH. And Dr. Rodrigo brings a fascinating global and clinical perspective to our community, having trained as a physician in Europe and a pathology resident in UC Davis before joining the program. I can just say so many great skills that I have seen Dr. Rodrigo implement in the program and beyond. So he's currently working in clinical trials and I just believe is a perfect example of how an MPH can be used to bridge the gap between high-level research and direct patient care. So there's a Q&A, and I would love if y'all have any questions for Dr. Rodrigo to ask away. But in the meantime, Dr. Rodrigo, do you have anything that you'd like to add?
Not this time. Thank you for that wonderful introduction, Stephanie. Yes, if you guys have any questions, let me know.
Thank you. And then Hope Delgado will be joining us in a few and later in the conversation. But in the meantime, I would still like to share a highlight. She actually recently earned her MPH in 2025 and recently joined Fresno State's Department of Public Health as part-time faculty. So similarly, she's interested in the intersectionality of public health practices and medicine. Hope is dedicated to returning to Carruthers, which is where she is rooted in to serve as a health provider down the road. She aims to address social determinants of health and inspire local students to pursue higher education. And really excited to have you both be here. As you can see, Dr. Rodrigo completed his concentration in epidemiology and biostatistics, whereas Hope focused more on the interdisciplinary. So a lot of great information and context that we can share down the line. I'll pass this back to Elise to kick off with the agenda.
Alrighty. So yes, we did introductions already, and Hope will be joining us in just a little while. So that's great. I'm going to talk in a moment about what makes our program unique. We'll talk about sort of the field of public health, what our alumni and current students are doing, like their salary, different employment options in this field. We'll do a program overview, so talk about some of the logistics of this program, the various career support that is available. We'll also talk about, or we'll do a Q&A, and then we will cover some of the important factors like cost of attendance and how folks fund this degree. And lastly, we'll go over the admissions process. Great. So some of the things that make our program unique, we offer a diverse, rigorous, and stimulating academic program. And you might be wondering, well, what does that really mean? So I think it means a lot of things. First of all, I like to share that our online Masters in Public Health program has been around for a while. We were actually UC Berkeley's first online program. We've been around for around 14 years. So I think we've really dialed in how to deliver high quality online education. I know that a lot of different online programs popped up during COVID. We were here long before that and have been honing our process for quite some time. So that's something we're really proud of. In terms of what a diverse academic program looks like, I mean, a lot of different things. So we have, Stephanie will cover this in a moment, but we have a variety of different areas that you can concentrate. So a master's in public health degree can lead you down many different paths, and we have different ways that you can tailor the curriculum to your specific goals. We have 41 different courses you can choose from. Um, and we think that, that we're really delivering the Berkeley standard. We know that you're Berkeley students and, you're accustomed to high quality education. We're the number one public school in the country, and that really carries through into this program. Um, we are the same program that we offer on campus. It's the same faculty who teach in the on-campus program are teaching in the online program. We really just want to ensure that students have access to a high-quality Berkeley graduate program while being able to work full-time, because again, this is a part-time online program. And we want folks to be able to move, to leave the Bay Area if they want to, or stay in the Bay Area and work full time. There's we want to provide this flexibility. Some folks hoping one of them, isn't living in the Bay Area, so being able to like return to the community that you want to be part of, or move to another state if you'd like to, and still be able to get this high quality education is really important to us. Close-knit community. We'll talk about this in a moment, but something that we really value is developing community amongst our students. Even though it is an online program, we really want to ensure that students are connecting with each other. So we do that through group projects. We also have a really fun experience called the summer visit, where all of our online students actually come back to Berkeley's campus. We plan essentially like a conference for you all with guest speakers. We'll talk about that more in a moment. But despite it being an online program, we make a big effort to have this feel like you are in community, that you know your cohort members, that you know your faculty. Which brings me to my next point, is that we offer a supportive learning environment. Some online programs outsource aspects of the program design or the support. That is not the case with us. We are a Berkeley program through and through. So there is a team of Berkeley staff who are here to support you. Stephanie and myself are two of those people who are here to help with the admissions process. We have a team of academic advisors who will help you with your course planning. We have faculty advisors, again, who also teach on the on-campus programs. They're here, they're around, they're on campus. You can meet with them. They hold office hours. And we have a team of instructional designers who, again, are full-time Berkeley staff who are helping make sure that we're delivering really high quality online learning to you. So yeah, these are some of the things that we're really proud of as a program and why we think we stand out amongst other online MPH programs.
Awesome. So, what is public health? So, public health promotes and protects the health of all people and their communities. This is science-based, evidence-backed field that strives to give everyone a safe place to live, work, and play, according to the American Public Health Association. And in addition to that, you can expect different types of roles, such as what Dr. Rodrigo does, and he can speak to that. But you'll see folks in many different avenues. This can be local government, all the way to hospital systems, digital tech, research work in that type of field. Um, average salary that many of our students start out with is usually within the, I would say, six-figure range between 111,000 minimum as entry positions coming in with an MPH. And the salary can really range depending on the level of work and skills that you have as well. So I'm happy to share more about that with how our school can support you with employment and what type of connection that has towards your practicum. We have a couple slides on that. So I just wanted to highlight that quickly. Program concentration. So coming into grad school, there will be very niche subjects that you might be interested in, or maybe you have a flexibility and broader approach to how you want to complete your graduate degree. So if you are in a space where you are thinking more broad and like to see the many different intersectionalities of things, the interdisciplinary is a really great space to be in as it covers concepts around community health sciences, global health, spatial data sciences. And if you're interested in, I like to think of it in buckets, perhaps health management, you see yourself in a leadership position in healthcare, you can be in health economics or health policy, really making changes in that capacity. And this is a really great aspect to consider. And in addition to the health policy and management concentration, we have three select classes in there that you can complete to also earn your health management certificate. So you can earn a certificate while working towards your MPH degree, which is really nice. Food nutrition and population health, I think, is really centered around food research and food policy, really looking at the underlying aspects that really, make a impact to when your food gets onto your table. So looking at all of that and all the different factors, you can combine that with research work. You can be more applied in this avenue. A lot of our students that tend to be interested in this space, work within dietetics or focus more on food and well-being in partnership to that. Epidemiology and biostatistics is something that I really love. I always say that you don't have to be a researcher to take interest in this aspect, but you can gain a lot of tools and skills necessary to be an effective public health leader in your role. Epidemiology and biostatistics, I think, does a great job of helping you understand the questions that you want to ask, being able to demystify any biases that can come around because you're researching evidence-based work to be able to demystify certain things that are placed within the field of public health in our communities. You're able to look at numbers and be able to use that information to make effective input, and you're also able to take data and organize it in a way and really help your teammates, your collaborators to understand how, why, what, and all the fun stuff around it. And I would say, coming into the program, it's very helpful to explore our website first, see if you have any interest in any areas, look at it further, and then come talk to me if you have any more questions around it. Moving into the program overview. So just to quickly share, our program is a part-time program. So it's offered as 90% online. Most of your work is considered asynchronous, meaning that you're not joining in live at a specific time. Most of the weekly deliverables are typically in an asynchronous format. It's offered as 7 semesters, so you'll complete the program in 7 full semesters. It's a year-round program. And we are also 10% in person. So there's 2 required summer campus visits. So this means that you will have to attend annually a 1 week long visit here, which we have more information about. But the type of degree that you would receive is a professional MPH program. So this is very skill-based. It is structured in ensuring that you are able to apply your coursework into real life experiences, real life professional skills. And this degree does not indicate that the program was completed online. You will earn a traditional Master of Public Health degree or diploma. It'll say Master of Public Health, but it does not denote anything other than the format that you've completed it in. The course delivery in the program, so its lecture materials are that I mentioned are asynchronously taught. So that's not live, but they do have weekly deadlines. So it's not a program where you just do your thing and submit when you want. We actually have weekly deadlines to follow as you will be integrated in group-based work, some independent work, and office hours. That is going to be real time. So if you would like to meet with a faculty member, sometimes they have office hours in person. A lot of times they will offer it through Zoom, by phone, and just different modalities for you. Course model. So the first year students are required to complete 6 core and breadth classes, and they are pre-assigned coursework. So this means that there's no guesswork in your first year. Think of it kind of like your first year in undergrad, where it was general courses. It's kind of the same approach to that. We really want you to explore what your interests are. We want you to be able to not have to stress so much and figure out what classes you need to take. So we'll set that up for you. You just got to enroll when the window period opens. But additionally to that, the breadth courses, I think they are very important for you to understand how these courses really work together. How do they talk to each other in real world experiences? And this can also give you exploration time to figure out if you are interested in a particular area and want to focus on that. And with the second year, by the end of the first year, you'll get to decide which concentration you really want to lock in on. So in your second year, you'll complete courses that are geared towards your concentration and elective courses. Moving forth, student services support. So students are paired with a program manager and a faculty advisor for academic and program support. So similarly to the center or CE3, I should say for short, there is a hub of resources, right? In the same way, we also have that for our grad students. So if you have logistical questions about course mapping, you're like, I'm not sure what I need to take, I'm not sure what I need to do, you'll have a program manager to support you. And let's say that you're looking in mentorship. This is a faculty advisor that really specializes and has a lot of knowledge in that area that can provide you a lot of mentorship in that particular realm. So average time commitment is probably about 15 to 17 hours per week, give or take. There are going to be some weeks where maybe you might want to, use a lot more focus time. So you'll increase that average commitment. But for the most part, once you really get in the groove of things, our students have reported this to be an average time that they will spend dedicated to the program. Homework, reading, assignments, group work, all of that is combined to that. As I mentioned, it is a part-time program as well. The average units enrolled in the program is 6 units. It's not a full-time program, so you can only increase your workload to 9 units, but your minimum is typically 6, 2 courses a semester. The units required to graduate is 42. And the capstone. In our program, we do a comprehensive exam. So this is an open book exam that measures everything that you've learned throughout the program and gives you an opportunity to test you on that. So we do prep work before you even get to the comprehensive exam. So we want to ease you into the space here. This takes place at the very tail end of the program, so closer to graduation. And it's an exciting part because these are things that you have done and we know that our students will do well in this. So it's an exciting part because you graduate right after. And I will pass this back to Elise to speak a little bit more about the required summer visit.
Yeah, awesome. So one thing, I mentioned it earlier, but one thing we really love about our program is though we are primarily an online program, we do have 2 in-person visits. And so essentially, you'll do most of the coursework online asynchronously. And then each summer, the 2 summers that you're in the program, we bring all of our online students back to campus. And typically these visits are 5 to 7 days. And we build it out sort of like a conference. We bring in guest lecturers. Some of your faculty will lecture in person during this time. Yeah, I mentioned we have guest speakers. We'll do professional development. We build in an anti-racism workshop. We have networking events, social events, and we try to make it an opportunity for you to connect with your faculty in person and your cohort in person. So this tends to be the highlight for many of the students. Certainly, John and Hope can talk more about this, their experiences at summer visit as well. But yeah, generally, this is a highlight for us as staff, for the faculty, and for our students. And it's also a great time for you to connect with folks doing different things in the field of public health. It really builds out your personal network and your professional network. So you'll meet folks who are, sometimes like very senior in their careers or folks who are just starting out in public health. And it provides just an incredible professional network as well.
Yeah, so with the fall program timeline, as I mentioned, you are taking 7 semesters with us. However, let's break that down there because there's a lot of flexibility for you. So most students in the program are going to complete the program in a traditional format. So that's the top row that you see here. And you're essentially taking 2 classes a semester all the way until graduation. So 27 months total. As you can see, there are some blue bubbles here. So what that indicates is that your classes are stacked. For full 15-week instruction, we typically have your first 2 semesters taught at a slower pace of the full term, and we stack those classes, meaning you're enrolled and you're taking 2 classes together at that same time. And it really helps the students, I find, ease into the program, really learn the online environment, really learn more about a particular area and just get situated. But once you get to your summer term, this is where things are going to speed up because we want you to still be enrolled in a 15-week instruction. But what we do is instead of stacking the classes, we actually have you take them back to back. So they are consecutive courses. And what this does is it really helps you fine tune the areas of concentration. We really want you to focus in and lock in on that particular class, right? And be able to bring that back into your job, bring that back into your volunteer work, whatever it is that you might be working on if you are working on anything at that time. And that process will follow suit until the end of program. In the second row, for some students that may have more availability in their schedule, you are able to possibly increase your workload to 9 units in the second year. So as you can see, the first year is pretty structured. We don't make any changes really. But in that second part of the term, if you wanted to increase it, you would have to enroll in 3 classes, which is 9 units. So that's the most that you can do. It's not a full-time program. I would recommend if somebody is interested in taking beyond those units to consider a residential program that may be more willing in that capacity. Our program is very structured and it really works in a specific way to ensure that you are collaborative with your peers, but also working at a pace that feels balanced. And that's something that we prioritize. And then that said, in the last row, if you need to take a break, maybe there is a life circumstance, maybe there is something very unique, a job promotion, or sometimes we have folks that are in the military as well that, get called for active duty. So if you need to take a break, this is something that can be feasible as well. You can complete the program up to 5 years, and there are just many pathways that you can consider. So keep that in mind as you explore different programs. And I'll pass this back to Elise.
Great. So one of the other things, and again, you'll hear us repeating some similar themes and ideas, but I mentioned that we really pride ourselves in being a very supportive program. We have a lot of dedicated staff who will provide wraparound support to our students. One of the areas that we like to do that is also in your career and professional development. So we have something called the RISE office, and this is a group of staff who are here to support you with career planning, leadership development, and also your practicum project. So Part of our program is that we require a 130-hour applied practice project. Essentially, it's an opportunity for you to apply the skills that you're learning in the classroom to a real world scenario or real world project. The RISE office are there to help you help you come up with a project, to find where to do your project. Sometimes there are like different practicum opportunities that folks can join, so they would help you with that. They'll help you stay on track. And then again, the career planning, they can do resume building with you. They can do interview prep with you. They're here to support your job hunt. They also have a system called Flex where you can look up different job opportunities. And then leadership development. So something else they do is often they'll provide like workshops or they'll have guest speakers come in to do some of these leadership skills development courses. So Rises is a great resource that all of our students have access to as part of the program. All right, so we're going to go over some of the logistics. Cost of attendance, we know, is a huge factor in planning and preparing for grad school. Right now, our program fees are $1,629 per enrolled unit. As Stephanie mentioned, this is a 42 unit program. That's spread out over 7 semesters. So you're only paying for the courses you're actually enrolled in that semester. So it's typically 6 units a semester. So you're paying that $1,629 times 6 for a given semester. On top of that, there's some Berkeley campus fees. Some folks ask, why are there Berkeley campus fees if this is an online program? Fair question. But first and foremost, you are a UC Berkeley student, so there's tons of campus resources that you still have access to, even in an online format. Library resources, the financial aid office. If you happen to be in the Bay Area, you can of course use all the campus amenities. There's counseling services, things like that. So you're still getting access to the bulk of UC Berkeley resources just in an online modality. There is something called SHIP, the Student Health Insurance Plan. If you have health insurance through another means, like for instance an employer, you can waive the SHIP fee. There's document management fee and instructional resilience enhancement fee. These basically just go toward ensuring that we are keeping our program or our courses up to date, that they look nice, that they're accessible, and we want to make sure that we're continuing to provide a very high quality online learning experience. So that brings the total cost of the program, again, over 7 semesters to around $75,000, excluding SHIP. So how are students paying for this? There's a variety of ways that our students will choose to pay for the program. One option is being self-funded. So because this is a part-time online program, the majority of our students are able to work full-time while going to school. And that can enable folks to either pay partially or fully out of pocket. If you are going the self-funded route, you are welcome to set up a fee payment plan, which will break those semesterly fees into 5 monthly installments. One way that many of our students help pay for the program is through federal student aid. This is unsubsidized student loans. We highly encourage everyone to fill out FAFSA, even if you're not sure if this is something you want to use or not. It's just good to see what you're eligible for, how much you could take out. And then for those who are eligible, some of those loans can be converted into work study, which would mean you can take on a campus job, and some of those loans would be converted into employment instead of a loan that needs to be repaid. There's also some students who've taken advantage of public service loan forgiveness. This is typically applicable if you're working full-time for a government or nonprofit agency while going to school. One thing I'll note is definitely to check out that PSLF website that we've linked here, because some of the some of these loan forgiveness programs are changing or have changed. So it's always good to check what's most current there. And then employer sponsorship. So again, if you are working full-time while going to school, definitely check if your employer offers a tuition benefit. Many employers will contribute toward your education, like an annual limit or reimbursement, or sometimes they'll pay part of your tuition upfront. So definitely explore if this is an option. If you're job hunting, it's also something to keep an eye out for when you're looking at your benefits package. Uh, External funding sources. So we also highly encourage folks to look into external scholarships that might be available. One resource is ASPPH. This is a public health organization, and they have compiled a list of scholarships that are specific to the field of public health. I also always encourage folks to look locally, if there are any like professional organizations you're part of or affinity groups that you're part of or something specific to your community. Definitely check out any sort of external scholarships that you might be eligible for. And lastly, we do offer one scholarship as well, and that's the Dean's Health Equity and Leadership Award. We award this to 3 students each term, and it covers around $11,000. All right, so admissions. I'm going to go through this sort of quickly so that we have time for Q&A, but if you have questions about the application process, that's what Stephanie and I are here for. So we do have a few prerequisites. We're looking for college level math or stats passed with a B plus or higher and a minimum of a 3.0 GPA. Essentially, this is because we do have some quantitative heavy courses early on in the program. But if you have any concerns about these prerequisites, we do a holistic review. We won't be ruling folks out based on one specific thing. So definitely, if you're falling below that 3.0 or you haven't met that stats or college level math prereq, talk with Stephanie or myself, and we can see if there's another way you can demonstrate preparedness for the program. Required items to submit. So we look at your advanced GPA actually. This is your GPA typically from your last 2 years of undergrad. It tends to be a little more favorable than the overall GPA. We require 2 essays, a statement of purpose and a personal history statement. They are distinct, they have separate prompts, and we can answer more questions about those if you have them. We require 3 letters of recommendation from either academic or professional sources. So, a supervisor or professors that you've worked with. We do require transcripts from every institution you've attended, so Berkeley transcripts, as well as if there are any community college courses that you took or if you transferred, things like that. So we do need to see transcripts from every institution you've attended. We want to see a resume or CV with your professional experience. There is an application fee. And if you did your undergrad, which I don't think this would be applicable, but if for some reason you completed your undergrad in a country where English wasn't the primary language, we may require an English proficiency exam. And then some very good news is that we do not require GRE. So you don't have to worry about that for us at all. We are accepting applications right now for our fall cohort. So if you're graduating soon and you're thinking about your next step, definitely keep this in mind. Our deadline to apply to start the program in August is March 2nd. So just around the corner, but still a few weeks away. If that feels too soon and you're kind of just learning about public health, we do also accept applications for the spring term. That would be to start the program in January of 2027. And we accept applications until August 2nd for the spring term. All right, so these are this is our contact information. Stephanie and I have a couple other events coming up if you're interested in joining us for any of those. We will also include some of this contact info in the chat. But with that, I'd love to kind of turn it over to Q&A. We thought we could do start by doing a little bit of a Q&A with John and Hope, and then we'll open it up for broader questions. So Stephanie, I'll pass it back to you for that.
And thank you everyone for watching.